Yeah, so it was an interesting meeting at this recent ASCO meeting from a prostate cancer standpoint. I think a lot of it was driven by our better understanding of patients with DNA damage repair mutations. I mentioned the quality of life data earlier, and it's interesting that despite the increased toxicity seen with treatment intensification with PARP inhibitors and first-line antiandrogens, it didn't impact quality of life sufficiently. Although I think in clinic, we still have to deal with the toxicity, so it may not impact our clinical practice decisions that much, but it's interesting data to have and discuss. I think that there was also some very interesting data presented about the outcomes of patients with mutations in the DNA damage repair pathways and how those patients have worse outcomes. I think we knew that, but there was some added detail presented at the oral session. In addition, there was further follow-up from the TELEPRO-II trial, which continues to highlight benefit in patients who had mutations, but also substantial toxicity. I think one other thing that was presented was new data looking at lutetium with a PARP inhibitor, which I think presented some interesting preliminary data and safety data, although we're still going to need to have a better sense of how that will play out when they actually start looking at outcome data. And Dr. Vanderweel did a good job of putting those last three abstracts into context with his discussion, highlighting that I think we still need to understand better the role of PARP inhibitors in first-line metastatic castration-resistant prostate cancer. We don't have any survival benefit available from these trials thus far. So it's an interesting time in prostate cancer. I think we have a lot of therapies, and we're still trying to figure out the optimal way to use them and balance quality of life of the patients and clinical outcomes.